Hi, I'm an information specialist for the Genetic and Rare Diseases Information Center, also known as GARD. In this video, I'll share some of our go-to trusted resources that can help you find information about treatment for rare diseases. GARD is a service for the public that is funded by two parts of the National Institutes of Health, or NIH, the National Center for Advancing Translational Sciences, or NCATS, and the National Human Genome Research Institute, or NHGRI. You can start by searching for a specific disease that you want to learn more about in the Diseases section of the NCATS GARD website. I'll be using Lynch syndrome as an example. Check for a treatment section on the disease page. Here we list management guidelines, links to clinical trials, and approved medical products. The medical products listed on our site are medicines for rare diseases that have been approved by the U.S. Food and Drug Administration, or FDA. In the table, you can find information about the medicines, links to information about the company that makes them, and information written for patients. Gene Reviews has information about medical care for many inherited diseases. The articles found on their site include topics such as exams you might need after being diagnosed, medicines and other treatments, and screening tests that look for other medical problems that could develop in the future. Gene Reviews articles are written by professionals who are experts in the condition. If you want to find out if there's a clinical study testing new or existing treatments, we suggest you visit the NIH website clinicaltrials.gov. Once you find a study, read the summary that describes what happens in the study and who is eligible to take part. Choosing to be part of a study is an important personal decision. Talk with your healthcare provider and family members or friends about deciding to join a study. To learn more, you may contact the study research staff using the contact information that is provided in the Contacts and Location section at the bottom of each study page. If you're interested in treatment-related research at the NIH in Bethesda, Maryland, you can get help finding trials by calling the NIH Patient Recruitment and Public Liaison Office toll-free at 1-800-411-1222. When searching for treatment information, we encourage you to also visit our section called Your Questions Answered. Here, we post our answers to questions we have received from the public. You may find that we've already answered a similar question to the one you have. If you're looking for a basic overview of the treatment options available for a disease, support organizations are a great source for this information. Check the organization section of the GARD disease pages to see if an organization for your condition is listed. These groups may also provide professional guidelines for medical care and list medical centers with expertise in your rare disease. Also, check out our overview section. Here we list additional information sources that often have information on treatment. In particular, Medscape reference articles are a good source for detailed information about treatment. These articles are written for healthcare professionals. After accessing the article, you can click on the tabs for treatment and medication. This resource also often has a section on prognosis so that you can learn what to expect in the future. You may need to register to view the Medscape reference articles, but registration is free. There's a lot of information out there, and it can feel overwhelming. However, we hope that these tips will help you find information about available treatment for your condition. We suggest that you discuss the information you find with your healthcare provider and talk about which options are right for you. In addition, people also find it helpful to talk with other patients who have gone through treatment. Many advocacy organizations have patient forums or can match you with other patients where you can discuss the condition with others online. If you still have a hard time finding treatment information, please contact a GARD information specialist.